Hello everyone. So in today's lecture we will be learning about antacids, how they perform their action. So in chemistry or in basic science you already have heard about neutralization reaction, which is when there is reaction between a base and an acid. What happens? Acid, suppose acid HCl. So what happened? There is a neutralization reaction which is preceded by the formation of a salt and water. Na come from this and chloride came from acid. This caused the formation of salt and hydroxide ion and hydrogen ion combine to form water molecule. So this reaction is called as neutralization reaction. In neutralization reaction there is actually formation of any salt and water. Concept behind neutralization reaction that when a base and acid combine, they cause the formation of salt and water. So this is the general thing, whereas this was the example that I was giving to you. So what was the purpose behind telling you this, that there is a neutralization reaction? The purpose of telling you about this neutralization reaction was that in our stomach there is secretion of HCl, but when there is excess of secretion of HCl, it can cause acidity, which can lead to further complication like ulcer or gastroesophageal reflux disease. I mistakenly cut the word gastro, but it is present actually. It is mostly known by its abbreviation, that is GERD. Now ulcers can be of many types. They can be gastric ulcers, which are present on the inner lining of stomach. The second type of ulcers are those which are present on the inner lining of small intestine, and those are called as duodenal ulcers. The third type of ulcers are present in esophagus, and they are called as esophageal ulcers. So what are antacids? These are actually weak bases which cause the neutralization of this acid which is being produced inside the stomach. So what will happen when there is reaction between acid and base? This is called as neutralization reaction, and there is formation of salt and water. So this is how antacid works. They neutralize the acid which is causing trouble inside the stomach. So by doing so, it not only neutralizes the acid present inside the stomach, but it also causes the inactivation of an enzyme called as pepsin. This is a proteolytic enzyme which causes the digestion of proteins, and this enzyme is activated in the presence of HCl from pepsinogen. So when there is pepsinogen, it is converted into pepsin in the presence of HCl. But what happens when there is antacid present? It will decrease the acidity, and when there is decrease of the acidity, what will happen? It will cause the inactivation of the enzyme, because pH of 4 is required for the activation of pepsin, which is only available when there is acid present. But when there is intake of antacid, what happens that the pH of stomach increase from 4. So in this way there is inactivation of pepsin, because pepsin require pH below 4, but now it is increased from 4. So it will not cause the activation of pepsin. So not only it neutralizes the acid present in the stomach, but it also inactivates the pepsin, which is the proteolytic enzyme. And now how can you determine if an antacid is effective or not? It can be determined by two things. One is that its capacity to neutralize acid, that how much of the acid it can neutralize. And the second thing is that if you are taking it before meal or if you are taking it while having food in your stomach. So when there is food inside your stomach, what happens that there is delay effect of the stomach emptying. So what will happen when there will be delay stomach emptying? It allow more time for the antacid to react. So in this way it increase the efficiency of antacid. So therefore you always have to take antacid when you are done with your meal. There are various products available of antacid which vary widely in their chemical properties and their capacity of neutralizing acid and their palatability and their price, of course. So commonly used antacids are combination of two salts. When we are giving something in combination, it means there is some reason behind why we are giving it in combination, which we will learn later on. So in this case, which of the two salts are that we are giving in this combination? That are, one of them is magnesium hydroxide and aluminium hydroxide. So magnesium hydroxide and aluminium hydroxide are most commonly used in combination as antacid. We can also use any other salt of magnesium and aluminium together, but this is just an example that I have given to you. Another salt that we commonly use is calcium carbonate. One thing to be remember when you are talking about calcium carbonate, as you know, when it will react with acid, what will it cause to form? It will cause the formation of carbon dioxide along with calcium chloride. So this carbon dioxide can be troublesome to some patient who already have some gastrointestinal bloating or flatulence. So it should be avoided in such patients because carbon dioxide can worsen their condition. There are some other salts such as sodium bicarbonate. But there is one problem with this type of antacid, and what is that? This type of antacid can cause metabolic alkalosis. Transient means it is short lived or short term, that it can recover later on. So what is metabolic alkalosis? In our body, hydrogen ion is considered for acidic or acidosis, acidic condition, whereas there is exchange of hydrogen ion with bicarbonate ion, and it causes alkalosis. And by this what I mean? I'm saying that when there is increase in the concentration of H ions, H positive ion in our body more than normal, so it will cause acidosis. Whereas when there is increase in bicarbonate ion, it will cause metabolic alkalosis. Because what happen, these two ions are actually working by exchange mechanism. Normal condition, we need to have balance between these two ions. But when this balance is being disturbed, there is either acidosis or alkalosis depending upon the ion that is in more concentration. So again, when there is increase in the concentration of hydrogen ion or when there is decrease in the concentration of bicarbonate ion, there will be acidosis. But when there will be increase in bicarbonate ion but decrease in hydrogen ion, it will cause the alkalosis or metabolic alkalosis and metabolic acidosis. So this balance should not be disturbed, otherwise it will cause either of the condition. So when we use sodium bicarbonate as antacid, what happened that this bicarbonate increase the concentration or normal concentration of bicarbonate's ion inside the body. So in this way, what will happen that this balance will be disturbed, and when there will be disturbance in this balance, either of the condition will appear depending upon the ions which is being increased. So in this case, there is increase of bicarbonate ion which is causing alkalosis. So there is metabolic alkalosis. So to avoid this condition, sodium bicarbonate is not recommended for long term use, because either of the case can make you sick. Acidosis is a common thing that we talk about, but alkalosis can be same as problematic as acidosis is. So therefore, sodium bicarbonate not long term use. Okay. So if we talk about therapeutic uses of these antacids, so what are the therapeutic uses? So we already know we are using it for creating balance or for neutralizing acid which is being increased in the patient having acidity problem or any ulcer or esophageal reflux disease. They could be anything related to increase in the acidity. Let's talk about therapeutic use. We can use antacids for the symptomatic relief of peptic ulcer, disease, or GERD, which means esophageal reflux disease. Now one thing you should ask your teacher, your instructor, what is symptomatic relief? It means that the drug you are taking is not curing the reason or the cause of the disease, rather it is curing the symptoms of that disease. So you may ask, what are the symptoms that it is treating? So generally we talk about acidity. So in acidity, what happens that you feel heartburn, you feel burning feeling inside your stomach, or you feel discomfort. So this antacid cause the symptomatic relief, which means it will cause the relief from heartburn, discomfort, but it will not release or it will not eliminate the cause which is causing the acidity. There is some disturbance going on in your body which is causing the acidity. In normal condition, this is not the case. In normal condition, you have a certain amount of acid being released which is required for digestion. But when there is excess, there is ultimately an disorder going on because of that increased acidity. So what happened that this class of drug, that is antacid, only gave you relief from your symptoms. rather than the reason or the etiology of that disease. Another thing is that it also promotes healing of duodenal ulcer. The ulcers which are formed in duodenum part of the intestine. So what ulcers are actually? Ulcers are sores. These are caused by increased acidity. So when there is a increased production of acid inside the stomach, what happens that it causes the activation of more pepsin inside the stomach, which in turn cause more digestion of protein. As we know, mucus, which is protective layering around the stomach wall, it is also made up of protein. So what happened that this excess production of pepsin also cause the digestion of stomach wall, which in turn cause the ulceration or sores inside the stomach. Another thing to be remembered is that whenever you take or prescribe antacid, it should always be taken when your stomach is full, because food digestion takes time and this will give antacid more time for reaction activity, and thus it will increase the efficiency of antacid. So as I have told you earlier that when there is a combination of drug being used, there is some reason why it is used in combination. What is the reason of using magnesium and aluminium salts together as antacid? There is some reason, and that reason is very important, which is that this magnesium hydroxide can cause diarrhea, while this aluminium hydroxide can cause constipation. So you know why we are combining these two things, because these two things have opposite effects. So when we will combine these two things, they will nullify each other's effect. In this way, we will have the neutral effect on our gastrointestinal tract. So this is the reason why we give magnesium and aluminium salt in combination. One may think why it causes diarrhea or constipation. So why aluminium hydroxide causes constipation? It causes constipation because aluminium relaxes smooth muscles of gastrointestinal tract. So what happens when there is relaxation of the gastrointestinal tract? What will happen? There will be less of the peristalsis movement, because peristalsis movement are actually combination of relaxation and contraction of muscles, of smooth muscles actually. So when there is relaxation of smooth muscles, what will happen? That this contraction will not be occurring. When there will be no contraction, what will happen? Your bowel movement will be obstructed and your bowel will not be able to remove or excrete it out from your body. Decrease peristalsis. Whereas why magnesium hydroxide cause diarrhea? The reason behind this is that it induce smooth muscles, which is opposite of the aluminium hydroxide. So when there is induction of smooth muscles and there is increase in secretion of water, which is also caused by this magnesium, what happen? There is the occurrence of diarrhea. So for this reason, we combine both of these salts together to avoid these complications. In this way, there will be nullification of these two effects and we will get our ultimate result which we want actually. So in adverse effect, we can write that magnesium hydroxide can cause diarrhea, whereas aluminium hydroxide can cause constipation when they are taken alone. But here we are talking about in combination, so we are not writing any adverse effect. but you can write in antacid that this is the adverse effect of magnesium hydroxide and aluminum hydroxide when they are taken alone. Other than this, cations like magnesium, aluminium and calcium, these ions usually not a problem for the patient with normal renal function, but when there is some patient that is actually renal impaired or that has renal failure, for such patient antacids can be problematic because that patient cannot filter or cannot absorb or function accurately for these ions. There can be accumulation of these ions in case of patients with renal impairment. So it may cause the accumulation of these ions inside the body of such patient. So what will happen in this case? There can be toxicity of these ions. There can be condition that is called as hypercalcemia, hypermagnesemia, other things that are related to these ions. So this was all about antacids. If you have any questions related to the topic, let me know in the comment section below. And thank you for watching my videos.